All right, everybody. Well, I will go ahead and kick off the meeting then. Alex Brabunovich. I oversee the Health Benefits and Wellness Division at Lacers. And I'm just going to go over a few details about open enrollment and about the new plan year in case you missed our Lacers meeting last week. And I'll just take a few minutes. We'll hand it over to Stephanie, our wonderful wellness program coordinator, manager. And she'll tell you a little bit about our program, and then we'll give it on over to our main star, Chantel, to talk about UnitedHealthcare. So hold on, we're about to begin this ride. I'd like to say fasten your seatbelts, but it's not going to be a bumpy ride. So you're probably aware, open enrollment is held October 15th to November 15th. And so this is the time where if you're not already enrolled in a Lacers plan, you can enroll in one of our plans. Also, during this time, you can add a dependent, or if you want to change plans, this is the time to do that as well. Outside of open enrollment, the only opportunity for you to make any of these changes, excuse me, is if you have a qualifying event, such as moving to a new location where your current plan doesn't provide coverage, or if you have a new member to your family and you want to add them to your plan. One thing I want to make sure you're aware of is that our past open enrollment period, the one that started last year, it was an unusual one. We extended it, so it didn't end November 15th like it does this year, or it has in previous years. Instead, open enrollment was extended all the way through the end of March. All right, so we're continuing our streak of really great renewals. We either had reductions or very minimal cost increases over the last few years, and that trend is still continuing. We actually, overall, our premium costs, we're actually seeing a decrease of 1.3% for next year. And so our overall annual premium cost is going to be $152 million. That's estimated. I mean, that's a huge number. When I see that number, I'm so overwhelmed and impressed. That's just crazy. But that's the cost of our all of our premiums added together for medical, dental, and vision. We have approximately 24,000 covered lives. And so, again, that's a big responsibility that Lacers takes very seriously, making sure that all 24,000 people have their benefits, that they're enrolled, and that they're able to access care. And the wonderful thing about this year is that although we're seeing a reduction, a lot of people might assume, well, what did you cut out? Well, we didn't cut out anything. In fact, we've added things. And so UnitedHealthcare has a couple new benefits they'll tell you about as well. All right, just really quick, this is like the meat of our renewals and open enrollment, right? It's the subsidy. How much subsidy are you going to get that you can apply to the cost of our plans? It's great that our premiums overall are going down, but what does that mean to you? Well, the maximum subsidy, which this year is $1,790.80, is actually increasing. So the maximum medical subsidy for 2022 is going to be $1,884.50 a month. And that's incredible. I see that and I'm like, wow, Lacers does an amazing job providing health benefits. And the nice thing is when you look at all the subsidy dollars that we apply towards all those premium dollars, about 95% typically of those premium costs are covered by the subsidy. So, members really have very little out-of-pocket costs overall. I mean, some people have more than others, but overall, most have zero deduction from their paycheck. The subsidy covers their full premium. So, I mean, I think that's just amazing. So in terms of dental subsidies, the PPO subsidy is going to remain the same at $44.60 a month. The HMO plan, the maximum subsidy is going to increase slightly to $15.10 a month. Before you make a plan change this year, I just want to make sure you're aware of certain things. If you are thinking of moving, does the plan that you want to switch to serve the area that you're moving to? Just make sure, because we have had situations where members have moved to a new location. The hospital that they may have used before is very close by, but it's in a different zip code. And so their new residents is in a zip code that's not covered by their current plan. So then they had to switch to another plan, and the only option was more expensive, and they were not happy about that. So definitely, I know health benefits is really important to people, and it can affect your budget. So if you are planning on moving, just make sure you know what your options are. Call us. If you are on regular medication, make sure that you maybe get an additional prescription filled, just so you have it on hand while you're going through the transition to the new plan, in case there's some kind of hiccup. There shouldn't be, but you never know. It's always better to be safe than sorry. And of course, if you're receiving care and it's expected to continue during the transition, just make sure your current carrier and your new carrier are aware, so benefits can be coordinated. And really important, if you're wanting to switch plans and you know your doctor, and you want to keep your doctor, but you know your doctor accepts that new plan, you have to make sure they also are accepting new patients, because let's say you're moving from SCAN to UnitedHealthcare, and you know that your doctor accepts UnitedHealthcare. If they're not accepting new patients at this time, you won't be able to keep your doctor. So you'll want to talk to them and make sure that they are still available under the new plan. And then just any new changes in your costs, if you're going to have any payroll deductions, those will take effect in your December check, the check you get at the end of December. We do have some remaining open enrollment meetings after today, as I mentioned. We have the SCAN Medicare Advantage presentation on next Tuesday, November 2nd. We have the Delta Dental and Anthem Blueview Vision presentation next Thursday on the 4th. And then on the remaining 3 Fridays of open enrollment, we will have presentations regarding the new Anthem Medicare Preferred PPO plan. So that plan is going to be replacing the current Life and Health Medicare supplement plan. So finally, everything you need to know is on our open enrollment page on our website. There's the health benefits guide, all kinds of videos and resources from our carriers to help you better understand what they're offering. If you need personal assistance, you can go ahead and sign up to receive a call from us. And if you need to speak to a carrier directly, we can arrange that for you. You can access the forms. Also, if you did submit your forms for a change and you want to call to make sure we receive them, give us 3 days. We have a lot of work that we're that we're shuffling through and trying to get processed, and we won't be able to tell you necessarily right away if we received it. It might take a couple days before we get to it. So just give us a few days before you call in and check on that. If you need to talk to us, you can always reach us at lacers.health@lacers.org, or you can call our 800 number. So take it away, Stephanie.
Good morning, everyone. So glad you could join us today for today's UnitedHealthcare presentation. Before we get to Chantel, I wanted to let you all know about the Lacers Well program. Some of you may have participated in the program and are fairly aware of these opportunities to engage with your fellow Lacers retirees. But some of you may not have heard of the program. So I wanted to introduce this to you if you haven't heard of the program. So basically, I'm the program manager for the Lacers Well program. I'm responsible for the operations and the program planning. We also have Crystal, but Crystal isn't here today. She's responsible for the Champion volunteer program, as well as the Lacers event planning. We also have Betty. Betty is here on the call today, and she assists with welcoming newly retired members to the Lacers Well program. And so with that, I wanted to introduce you to our mission, vision, and our mission goals and the well-being. So our program is based on the 5 pillars of well-being. That is the purpose, physical health, financial wellness, social engagement, and community involvement. We work in collaborative with the health plan carriers such as UnitedHealthcare, and we work to control those healthcare costs resulting in savings that may be invested into support programs for you all, such as transportation, meal delivery, home care, and other valuable resources for retirees. Our mission and what we really focus on each day is to enhance retiree quality of life by providing you with resources and activities that promote your overall wellness and your improved health outcomes. We really consider it a privilege and honor to be able to provide these programs to you, and really encourage you to take advantage of these programs. So as I mentioned, those 5 elements of well-being, we built programs and activities around those elements of well-being. And there's so many opportunities for you to virtually engage with us around those 5 elements of well-being. In January, we launched the health and purpose surveys for retirees to evaluate areas such as pain, movement, and functionality. And participants also answered questions regarding their interests that support purposeful living. Also during the year, we invited expert clinicians such as Dr. Doris, Dr. Musai, and Dr. Pryor to give presentations on mental health issues and concerns, as well as provide us with COVID-19 updates. And we also have monthly tech classes offered or hosted by Elijah with Mom's Computer. Raise your hand, Elijah. And those are really popular classes that retirees engage in and learn more about how to use their computers, their smartphones, their tablets, and the internet. It's a lot of wealth of information that Elijah provides for us that we take away and learn something with each and every class. So really encourage you to participate in those classes. We also had financial workshops. Though we had an overwhelming response to those workshops, we had a financial mastery in retirement and scams series, as well as estate planning workshops. We had over 300 retirees participate in that. If you missed any of those workshops, you can find those recorded sessions out on our Lacers YouTube page. So our champion program is the heart. The champions are really the heart of the program. They are volunteers with the program that provide opportunities for you all to get together in groups. And we recently resumed our in-person outdoor activities. As you can see from the slide here, we have walks in the park, in the El Carrizo Park in Sylmar. We have Van Nuys Sherman Oaks Park walks with Debbie. The Greenway Trail walk at Palm Park with Terry. And I've actually done that walk myself. It's a really great walk. South Coast Botanical Gardens walk with Nancy. The Cabrillo Beach Walk Aquarium Tour. There's actually a special tour that is free. I'm not sure how many tickets are available, but you can reach out to Nancy, and it's a beautiful tour of the Cabrillo Beach, and we have a tour of the aquarium as well. And I believe that is next week. So if you're interested in that, reach out to Nancy as soon as possible. Then we have golfing with at Alondra Golf Course with Jimmy, and hiking in Griffith Rose Bowl area with Ben. If you're interested in becoming a Lacers Well champion, if you have a hobby or interest that you'd like to share with retirees and get a club going, reach out to us. Send us an email at lacerswell@lacers.org, and our champion coordinator, Crystal, will reach back out to you. And if you don't live in the Southern California area, we also have virtual activities that you can engage in. Cooking with Carmen, we have book clubs, and we have a hula dance club and a movie review club as well. So we are really appreciative of our champion volunteers. They really make this program what it is, and we really depend on them to engage and really make it a beneficial opportunity for you to participate in the program. So With that, if you want to learn more about the Lacers Well program, you can call us. This is our direct line numbers listed here. You can also call the general number and ask for either myself, Stephanie, or for Crystal. You can also email us at lacerswell@lacers.org. You can also look out for your emails. We do send out monthly emails twice a month. It's the last week of the month and the first week of the month. We have one that recently went out, and then we have another one coming out, I believe, next week. So look out for those. If you're not getting the emails from Lacers Well, check your spam folder or reach out to Lacers and make sure we have your most current and accurate email on file with us. You can also visit our website for the events, as well as the calendar on our website to get a listing of all of the champion activities, as well as the Lacers Well events happening. And then visit our YouTube channel. There's lots of recordings out there from previous events that we've held, and you can get a sense of what the program is all about. And like I said, the financial mastery and the estate planning was valuable information shared by experts in those areas. So check out those videos. You may learn something that you didn't know. And then visit our Facebook page and engage with our Lacers Well group there. We have over 600 members and on our Facebook group page. So, and that page gives you the opportunity to get first-hand knowledge of information that's distributed out to the Lacers Well community. So again, thank you so much for your participation. If you are a champion listed here or attending today, thank you so much for your participation. And for those that are interested in becoming a Lacers Well champion, please reach out to us and we'll connect you with the champion coordinator. All right, with that, I'll give it over to Chantel.
Thank you all for the opportunity to speak with you today about the benefits and programs available through Lacers Medicare Advantage plan. I'm excited to share information with you about your plan and benefits. During our time together today, we'll be reviewing original Medicare basics, your plan benefits, programs and features, and additional resources that are available to you. At UnitedHealthcare, we want you to know that we're here for you. We are here to help you make the most of your plan by connecting you to the care you need when and where you need it. We offer one-on-one support to help you get the most of your plan so you can be at your best health. We are also able to provide programs like Renew that offers a variety of useful resources, activities, and learning courses at no additional cost. We have Medicare's largest provider network and one of the most comprehensive drug coverage programs available. You can pick up prescriptions at a local pharmacy or utilize OptumRx mail order pharmacy. It's like having a drugstore at your fingertips. UnitedHealthcare is proud to have been serving the healthcare needs of people just like you for more than 40 years, and you can count on us to be here when you need. Now let's review original Medicare basics. To be eligible for Medicare, a person would be 65 years old or under 65 and qualify on the basis of disability or special condition and a U.S. citizen or legal resident who has lived in the U.S. for at least 5 consecutive years. If you or your spouse have contributed to payroll taxes, you are eligible for Medicare when you reach 65, regardless of your income or health status. Some of the benefits of choosing a Medicare Advantage plan are all the services found in Original Medicare Parts A and B, which are hospital stays and doctor visits, are included. And your prescription drug coverage is also included, all with the ease of a single ID card to access all of your benefits. The plan offerings available for Lacers retirees is a Group Medicare Advantage HMO plan. Now we'll review the benefit plans, programs, and features that are included. This plan includes benefits of Parts A and B and prescription drug coverage. That's hospital stays, skilled nursing facilities, home health, doctor's visits, outpatient care, labs, and prescription drugs. Your plan is considered an HMO. What does that mean to you? You have access to see doctors, go to clinics and hospitals, and coverage for prescription drugs. There's also vision, hearing, and additional benefits available to you. With your HMO plan, you must obtain care from an approved network of doctors and hospitals. Referrals must be initiated by your primary care physician. There is a large network of doctors, specialists, and hospitals under the HMO plan that you can choose from to get the services that you need. The provider you are currently utilizing may already be in the UnitedHealthcare network under your plan. To confirm if your doctor's in network, you can check online at uhcretiree.com or contact our customer service line at 1-800-457-8506. There is no annual deductible that needs to be met and an annual out-of-pocket maximum of $6,700. Under this plan, you will pay a $15 copay for primary care provider, specialist office visits, and urgent care. There is a $50 copay for an emergency room visit worldwide. This copay is waived if you are admitted to the hospital within 24 hours for the same condition. Inpatient hospitalization is covered at a $0 copay per admission. Outpatient surgery and medical virtual visits are also a $0 copay. There is also a hearing aid allowance of $2,000 every 36 months when using the UnitedHealthcare hearing program. You also pay $0 copay in covered preventive services, including your annual physical and wellness visit, immunizations, breast cancer, and colon cancer screening. Additionally, Medicare-covered chiropractic care and acupuncture are covered with a $15 copay. Under this plan, Tier 1 preferred generic drugs are covered at a $10 copay for a 30-day supply or $20 copay for a 90-day mail order. Tier 2 preferred brand drugs are covered at $20 for a 30-day supply or $40 copay for a 90-day mail order. Tier 3 non-preferred brand drugs are covered at a $50 copay for a 30-day supply or $100 for a 90-day mail order. Tier 4 specialty drugs are covered at a $50 copay for a 30-day supply or $100 copay for a 90-day mail order. Now we'll review some additional programs and resources that are available to you as a UnitedHealthcare member. Renew by UnitedHealthcare is a program set up to help you unlock your unique potential and live your best life. Renew gives you access to many resources, such as Renew Magazine, Brain Games, recipes, Renew Active Fitness Program, learning courses, videos, and more. Under the Renew Rewards program, you may also be eligible to earn rewards by completing certain healthcare activities, such as your annual physical or wellness visit. Renew Active is new this year. It is the gold standard in Medicare fitness programs for the body and mind. Renew Active provides you the chance to stay both physically and mentally fit with a free gym membership that allows access to our nationwide network of gyms and fitness locations, as well as brain health program exclusively from AARP Staying Sharp. It also includes a personalized fitness program, access to on-demand workout videos, and live streaming fitness classes. There are social activities at local health and wellness facilities and classes that allow you to connect with others. There is also a Fitbit community and Fitbit Premium available to you at no additional cost. Virtual visits allows you to have a live video chat with a doctor or behavioral health specialist from your smartphone, tablet, or computer, essentially anything with a camera built in and strong internet connection. Virtual visits are available 24 hours a day, and you can speak with a provider, ask questions, receive diagnosis, and the doctor can even prescribe medication and have it sent to your pharmacy. If a prescription is needed as a result of the virtual visit, the applicable cost share would apply for the medication. UnitedHealthcare Hearing allows you to receive a hearing exam and provides you with a wide selection of brand name and private label custom program hearing aids at significant savings. You can choose from many major manufacturers and receive your hearing aids in person or via home delivery. You will receive personalized care and follow-up support in person or with virtual follow-up care through Right to You, helping to you helping you to hear better and live your life to the fullest. To find a participating provider, please reach out to our customer service. One of the programs included with your plan is coverage for diabetic testing and monitoring supplies. These supplies, such as lancets, lancing devices, glucose control solutions, and meter replacement batteries, are covered at a $0 copay when you use OneTouch and Accucheck approved systems. If you are not using OneTouch or Accucheck, please check with your doctor to see if one of the systems will work for you. A temporary supply of your current brand can be requested while you work with your doctor to switch to one of the approved systems. With the Personal Emergency Response System, it's here to help you with a button. It's just a button push away. The Personal Emergency Response System in-home monitoring device provides fast, simple access to help 24 hours a day, 365 days a year with the simple push of a button. Members choose the product that best fits their lifestyle and receive the device at no additional cost. The in-home care benefit supports members who need help with activities of daily living and instrumental activities of daily living, providing members with routine, periodic visits to help with functional limitations and respite care for families and caregivers. Members are eligible for in-home non-medical care through our national provider care links. To receive assistance with things such as grocery shopping, meal preparation, light housekeeping, personal care, medication reminders, and more when you need it. This benefit includes 12 hours a month. The routine transportation program will help you get to health-related appointments easier at no cost to you. If you don't have a way to get to your healthcare appointment, our transportation program may be able to help. The program offers rides to medically related appointments and to the pharmacy for prescriptions. For routine transportation, you can get up to 30 one-way or 15 round trips per year. The trips are not subject to any medical requirements. Transportation must be to and from approved locations that are medically related, such as doctor's appointments and pharmacy trips. Transportation cannot be used for emergency-related situations. The post-discharge meal delivery benefit program is here to help you focus on your recovery without worrying about having a healthy meal after an inpatient hospital stay or a skilled nursing facility stay. A UnitedHealthcare clinical advocate can refer you for the post-discharge meal delivery benefit at the time of your discharge, and you can receive up to 84 home-delivered meals, usually within 72 hours after being discharged. All meals are ordered in succession of one another and cannot be spread out throughout the year. Meals are delivered to your door in a climate-controlled cooler in a fresh lock packaging and shipment of 14 meals or greater. Meals can be refrigerated for up to 2 weeks. If you have recently been discharged from the hospital or skilled nursing facility, you can call the number on your back of your ID card to be referred for the benefit. If you have any questions on your provider or pharmacy being in network, you can go to www.uhcretiree.com to check. Once you receive your member ID card, you can go to the website to register. Once you've registered, you'll be able to review benefit information and plan materials, print a temporary member ID card, and request a new one if needed. You can also explore Renew by UnitedHealthcare for information on health and wellness and get your explanation of benefits and more. Thank you for taking the time today to learn about your UnitedHealthcare plan through LACERS. We're excited to have you join the UHC family.
Yeah, I have a quick question. I just recently retired, and the question that I have is regarding long-term care. If supposedly you become disabled, I'll give you an example. I had a brother that just had a stroke, and he was taken care of at the hospital, which was Kaiser. Then they released him, and he basically has to get all his care and therapy and all that on his own. I would like to find out if my benefits cover any type of care after you're released from the hospital.
So Chantel could probably give you a
Yeah.
little bit more information on that.
So there was a portion in the presentation, I'm not sure if you saw that part where we had a little bit of care for after being released from an inpatient stay or a skilled nursing facility. Let me see if I can go back and.
I started the meeting just a couple minutes ago. So
Okay, no problem.
Yeah, I missed that part.
Yeah. So let's see, because you guys do have a little bit of a visit benefit for
I think
that.
it's 12 hours a month of income.
Yeah, so you guys get 12 hours a month provided through CareLinks, and they help with daily activities. They can assist with such things as grocery shopping, meal prepping, light housekeeping, personal care, medication, etc. So if that's something that you're interested in or may need to have access to, just give our customer service team a call and let them know once you get released, and they can go ahead and get that started.
Do you also have meal delivery through Mom's Meals?
Yes, we also do have the 84 meals that are offered for the Mom's Meals after a discharge from a skilled nursing facility or inpatient stay.
And that's with Kaiser. That's the medical provider that I have chosen for my retirement medical benefit.
Oh, no, these benefits are through UnitedHealthcare. I'm not familiar with what Kaiser may offer.
So how do I get information regarding the Kaiser benefits that I have?
So you can look in the health benefits guide. There's information there. Also, if you want, we could go ahead and have one of our Kaiser reps reach out to you.
That would be nice. You know, the thing is I was looking for my benefits guide, and I can't find that thing. I think my wife misplaced it or lost it in the trash. I was wondering what I need to do to get another one.
You could just request one. I could put in a request for you as well.
Oh, that would be great.
Yeah, so I just need to verify your contact information. So if you can direct message me in the chat, just send me your, make sure your name is spelled correctly and your phone number in case there's any issues. And I'll be sure to set something up for you, and also make sure you get a health benefits guide.
Okay, I got to try to find the chat that you're talking about.
Oh, if you, are you on a computer?
No, I'm on my smartphone.
Oh, okay.
I can look that information up, Alex, and send it to you.
Okay, I was just gonna look in the system to make sure, we have him in there, okay. Also, the health benefits guide, if you want to see it sooner rather than later. Again, if you go to our website, if you're comfortable using the computer, you can go to the lacers.org website and visit the open enrollment page. I believe Stephanie put the link in the chat, but you're on your phone, so it's more difficult. But if you go to www.lacers.org/enrollment, that should take you to the open enrollment page.
Okay, that sounds good. Let me do some investigation and I'll go on the website and see if I can locate the information you just gave me. I really appreciate your answering my question, Alex.
I want to know, I get a lot of calls from this new enrollment for Medicare. And I'm wondering what is the difference in my Medicare Advantage and these other Medicare Advantages don't have to pay anything.
Yeah, you have to be really careful because the way I like to frame it is no matter what, it's going to cost money to receive care. If there's a program out there that doesn't cost anything to you, like there's no premium, then there has to be costs somewhere else hidden. Either they don't provide as much coverage, or there's a deductible, or there's something somewhere. So I would just say be very cautious. The other thing that's really important for everybody to know is, especially during the Medicare open enrollment period, you're going to get a lot of information. People are going to try to reach out to you, sell you on different Medicare plans. And if you think, oh, well, I'll sign up for this, I'll have that supplement my LACERS plan. Well, your Medicare can only be assigned to one plan. So if you sign up for another plan, then your Medicare is going to be unassigned from LACERS and you will lose your LACERS coverage. And it's a big hassle to get you re-enrolled back into LACERS. So just be really careful and be really careful talking to people, because I've actually had members call me, more than one, where they were just talking to somebody about a new plan. They didn't say they wanted to enroll, but somehow they ended up being enrolled and they lost their LACERS coverage. And it was just, like I said, a big hassle to get them back out of that plan and into LACERS plans. So just be very careful. And, I would just compare the benefits, look at what we offer, look at how much we cover, look at the special programs we offer, and then look at what that plan that you're considering might offer. Again, the $0 premium might sound good, but then look to see where there might be some hidden costs.
Okay, thank you very much.
So hopefully we were able to answer all of your questions. Hopefully you received all the information you needed. Again, if you have any questions, reach out to us at LACERS. Chantel is always available if you need some help. So you can, let us know that you want to speak to United and we'll put you in touch. And really, more than anything, your health and your wellness is really important to us. And we want to make sure you have the coverage you need and you make the best decisions possible. So always know that we're here for you. And I guess with that, have a wonderful day, enjoy your lunch, and we will see you soon.